Now, here's where we're going wrong, and this is how we're going to solve this problem. We have over 200 different itises. So let me start from here. So if I have like some itchy scalp and I go to my dermatologist, they go, oh, you got some dermatitis. And I have some red eyes, I have some conjunctivitis. And I have a runny nose, I get rhinitis. And I have a stuffy nose, stuffy sinus cavity, and I have some pain, a little bit of fever, I get sinusitis. And then I go to my dentist and I have bleeding gums and I get gingivitis. And then I have a thyroid problem called Hashimoto's thyroiditis. And then I have a little bit, right now, I have a little bit of laryngitis because I've been talking all day, giving interviews. Some people get a sore throat, but they get pharyngitis. You can have reflux and stomach problems, like GERD, they call it, or reflux, and stomach pain. That's esophagitis and gastritis. Again, I mentioned colitis before. Men can get prostatitis, women can get vaginitis, we all can get arthritis, tendonitis. I mean, the list goes on and on. Now, everybody here in this audience, I can guarantee that we've had some of these itises sometime in our lifetime. Some of us have more than others. And the problem is then we treat it by micromanagement by each specialty in medicine, right? So here's my shampoo for my derm, here's my eye drops, here's my nasal spray, here's my inhaler for my lungs for my bronchitis, I forgot that one. Here's my upper pill, here's my lower pill, and here's my topicals, right? So everybody's treating the inflammation at the level that they see it, but no one ever asks the simple question, what is triggering all this inflammation, and where is it coming from? So that's where we have to go further. It's not just treating inflammation, it's looking at what is the cause of the problem. Now, inflammation over time can then trigger not only chronic disease, but it moves into a serious issue that you can increase your risk for cancer. So those patients that have colitis, inflammation of the colon, 43% over 30 years will develop colon cancer. That chronic inflammation causes degenerative changes. They also can trigger more growths of polyps, and those polyps eventually, more often than not, can turn into cancer over time. Same thing when we're looking at active rheumatoid arthritis. These are just a couple of examples. So someone who has active rheumatoid arthritis over 10 years has a 71-time higher rate of getting lymphoma, which is a cancer. Right? I saw 2 patients last year who had rheumatoid arthritis between 12 and 15 years, not managed or resolved, and had lymphoma. We have to look at resolution of disease. So from an integrative perspective, we don't manage disease, we resolve disease. That's the whole intention of medicine. It's supposed to be resolving disease. The problem is the system has been designed to manage your disease, to keep your disease going. So, you have diabetes, you have heart disease, you have blood pressure problems, and forever you have this condition, and as long as we're managing it with medications, management is not resolution. Okay, so we need to be moving towards resolution. Now, the good news is that chronic disease and cancer is predominantly preventable, 97%. So let me tell you this. Diet now is looked at as the largest contributing factor for chronic disease and cancer. Okay, it's about 35-40%. Smoking, which none of you hopefully smoke, or vaping now, hopefully none of you vape, those are also the second most common cause of chronic disease and cancer. Then obesity is number 3, so keeping your body mass index normal. Now, we've grown over time. We've supersized. It's not just the drinks. We as Americans have supersized ourselves, right? You can just go to Texas, for example, and see that. Southern half of my state, even the northern half of my state, obesity is now running rampant. Even morbid obesity is actually growing now in the United States. Infections mean that when we get sick due to our immune system being low, then we actually trigger inflammatory responses. So certain types of viruses, chronic virus conditions, can increase higher risks of certain type of cancers as well, like say cervical cancer and stuff like that. And then environmental pollution and radiation and other things. So some people are talking about like 5G, and we're looking at organics and trying to avoid the herbicides and pesticides and endocrine disruptors. So these are important things because these are all aspects. And then genetics. Genetics is, this is an old research model. The authors actually came back and redid that. It was actually 5 to 10% at the time in 2009. Now it's looked at as 2 to 3%. So disease that's genetically related is only 2 to 3%. But people will say, well, Dr. Pai, heart disease runs in my family. My grandfather had a heart attack. My dad had a heart attack. My brother had a heart attack. And heart disease is like the gene that I have. Genes aren't fixed that we used to think. Genes are in flux. Okay, it's called epigenetics. It's the diet, the lifestyle, the environment, and belief system that it turns on or off the expressions of genes. We all have been dealt the same cards. It's how do you play the game? And what this does with epigenetics, this is why we see things run in family, because it's the same diet and lifestyle, right? So it's something that grandparents pass down to parents, parents pass down to their children. Sometimes no fault of anybody. That's just what we knew. That's what we were told. That's what we were taught. But the nice thing is that we should be focusing on the 97% of disease and things that you can do daily that you can take advantage to control your health.